Are you a female struggling with fatigue? Well, if you are, I've got great news for you, in that we're going to talk about 3 lab tests that could be a game changer for you in terms of feeling better every day. Hi, I'm Dr. Arland Hill, and I want to share with you today 3 lab tests that I've learned to use in my practice that can absolutely help with fatigue and that are often not looked at frequently enough. Now, one of the things that I wanted to put out here right from the get-go is, why should we even be talking about lab testing in the first place? Well, right off the bat, number one is lab tests allow us a way to not guess. You know, especially if you're dealing with fatigue and you read different, maybe you've looked up things on the internet, you've Googled different things, you've read stuff in magazines or articles or whatnot, you'll see there are a lot of opinions about how to address fatigue, but the real question is, do any of those apply to you? And so testing allows you to know whether or not those really apply to you, so it allows you to know what to focus on and what not to focus on, so you can stop guessing is so important here. The next thing is that there are numerous causes for fatigue. When I lecture with other professionals, one of the things I always joke with them about are, patients coming in talking to us about fatigue and how many different causes there can be for fatigue. Now, fatigue is not a joking matter, as you well know. If you're struggling with fatigue, it overwhelms many aspects of your life. But when you're trying to put a finger on exactly what that cause can be, it can be very hard to decipher which direction do you go. How do you follow up? You almost want to throw your hands up in the air sometimes because there's so many different things that you could be looking at. So lab testing allows you to know what do you focus on and then what do you push aside and not put your attention towards anymore. The next thing is you want to know what you're trying. Is it working? When you start some type of treatment for fatigue, or whether you start an intervention, you want to know if the effort you're putting behind that is actually paying off. And if it is, great, you're on the right track, you're feeling better, and you would expect to see that in the labs also. But if it's not working for you, you want to know that as well. And the labs can help you see that much earlier than just in terms of how you feel symptom-wise sometimes. You can be on the right track to improving some of the causes for fatigue and not immediately notice that wow in energy, because a lot of times there's not that wow in energy. It's a slow, steady rebound of your energy. So the lab allows you to see, how is this process working for you? And then the last thing is, who wants to waste time? You've been dealing with fatigue long enough. You want answers. You're not watching this video because you're interested in waiting another year or 2 years to start feeling better. No, you're sitting here listening to this because you want to feel better now, and lab testing allows you to pinpoint now. Stop wasting time. No more guesswork, right? So let's talk about what these 3 lab tests are. Number 1 at the top of the list is going to be a complete blood count. Now, there's a lot of things that we can focus on with a complete blood count, and this is one of the most common tests that is ordered in all of medicine, both conventional and functional medicine. Blood counts are extremely important. They tell us about our red blood cells and our white blood cells, and the reason you want to know about red blood cells, particularly for this conversation, is you want to know, do you have an anemia? Now, something you might find interesting is that people have heard about an anemia, but oftentimes anemias get overlooked. Anemias are one of those things that, unless it's just blaring, jumping off the page, no one tends to want to follow up on it. But what I've consistently seen is that individuals who have even marginal or borderline anemias, these individuals need support too, and they're many times feeling just as bad as the individuals with fulminant, full-blown anemias. You need to know if you're struggling with anemia. And here's another key thing: if you listen to me say anemia and you think, oh, iron, I just need to take iron. No. We want to make sure that you have what type of anemia you have. There's several different types of anemia. Iron deficiency anemia is just one of those. So don't jump and automatically start taking iron. The next thing is, do you have an infection? Now, I want you to think about this for a minute. Think back when you've been sick. when you had a cold. Maybe you got the flu. And even when we talk about symptoms of the flu, what do we think about? We think about individuals who are tired, who are lethargic, don't have energy, right? You need to know if you're battling an infection, not necessarily of a flu or a common cold type of status. No, we want to know, do you have an infection that is at a low level that's zapping your energy every day? So the first test you need to look for is a blood count. Now the second test I'm going to recommend that you follow up on are going to be looking at your neurotransmitters. Now if you're not familiar with neurotransmitters, neurotransmitters are going to be your brain chemicals, the chemicals of your nervous system. And I shouldn't just isolate it to the brain because they're throughout the entire body, but they're the chemicals of our nervous system. Now there's a couple that we can focus on here, and you can look at these through laboratory, but honestly, questionnaires work pretty good for this a lot of times too. The first thing you want to know here is that you want to test the full battery of these neurotransmitters, because neurotransmitters don't work in isolation. They're much like hormones. And in fact, if you came to this video thinking that the lab tests I was going to tell you about were maybe thyroid testing or hormone testing, those are important, but I wanted to give you something different and novel here. And so that's where these neurotransmitters come in. And the thing to know about this as it relates to the hormones is that you can have optimal levels of the hormones and still not feel good if these neurotransmitters are out of balance. So these are real critical to focus on. The first one that I want you to look to here is going to be dopamine. Now, if you wake up in the morning and you don't feel like you have motivation, you feel like you're having to push yourself throughout the day, dopamine could be the issue for you. Dopamine is what drives you. It's what gets you going. It's what keeps you energized throughout the day. It's that immediate energy source. And the nice thing about, especially for you females, is that this is going to work hand in hand with estrogen. You can have adequate estrogen, but if you don't have dopamine there to keep that estrogen moving and to keep it working synergistically, those two work together, you're still not going to feel good and you're still going to feel fatigued throughout the day. So this is absolutely one you need to follow up on. The next is acetylcholine. If you're feeling like you're dealing with any brain fog, you don't have clarity of thought, acetylcholine may be the one you're struggling with here. And then lastly, if you're the type of personality who I like to call wired but tired, right? You can't shut your mind down, but you're fatigued. You just don't have the energy to go, but to do the things you need to do, but your mind is just going. You could be looking at a need for GABA. GABA is what calms your mind back down. It helps give you that slow, steady, consistent energy throughout the day. Now, those are two. What about a third test? I mentioned that there were three that you need to follow up on. The third test here is going to be looking at your gut. Now, the gut is so important in this conversation because realistically, if you don't have good gut function, we can simply say that you don't have good function throughout the entire body. But as it relates to energy and to overcoming fatigue, just know that it's linked to several other causes, several other causes, one of which is that it's going to be a supply of energy nutrients. We've often heard about probiotics and how beneficial probiotics are. Those probiotics are supposed to be able to produce energy nutrients for you. Your B vitamins, all your B vitamins, what we often think about as our energy vitamin, those are supplied by the bacteria, by those probiotics in our gut. When we start those chemicals that I showed on the last slide that support the nervous system, those are produced by the bacteria in our gut. So if we really want to overcome fatigue, we want to really get past that hurdle of struggling to have enough energy to get through the day. You know, some days you feel like, hey, I've got a lot more day left than there is energy to complete that day with. These are tests you got to follow up on. Now, wakes up the brain, right? The gut, that's the last thing here, is that it just fires up the brain. And if your brain is energized, you're going to be energized. Now, those are the three lab tests: a blood count, you're looking at your neurotransmitters, and assessing your gut. Hey, listen, guys, if you like the information that I've been sharing with you here and you think you found value in it, give us a thumbs up so we can get this information out to other people, and make sure you share it. Other people need to hear about this. You're not the only one struggling with fatigue. In fact, you probably know friends and family that are struggling with fatigue. Help them overcome. Help them find some answers as well. And lastly, if you're looking for more information about functional medicine and nutrition, make sure you check out my website, drarlandhill.com, where you'll find a lot of other information very similar to what we've discussed today. Thanks for listening. I look forward to sharing more information with you in the near future.